This program is brought to you by Hometown Veterinary Partners. Learn how you can get on the pathway to partnership at hometownvetpartners.com/vetcandy.
Hi, everybody. My name is Anthony Fischetti. I'm the veterinary radiologist and department head of diagnostic imaging at the Schwartzman Animal Medical Center in little old New York City. Teaching interns and residents is a really big part of what I do. I love doing it. I also have a veterinary consulting company called Veterinary Imaging of New York, where we help veterinarians from all over the country with their radiographic interpretation. I'm the webmaster for the American College of Veterinary Radiology. It's acvr.org. Check us out whenever you get a chance. And I'm excited to be part of VetCandy's NAVLE prep on radiology. If you have any questions, make sure you put them in the chat so that we can answer them for you. And what do you say? Let's get started. Okay. I would like to thank the interns who are currently rotating in radiology at AMC. They helped me with this NAVLE prep in terms of finding cases that they thought would be helpful for taking the test, since they took it a lot more recently than I did. I haven't taken that test in, oh boy, 24 years. Oh, it's a long time ago. Let's get at it. I like to call this basically radiology flashcards. Okay, it's gonna be somewhat fast-paced, and we're gonna go through different systems on the common abnormalities that you would see on a dog or a cat. I have mostly dogs and cats for preparation today. Sorry, no pigs, no large animal. We can't fit them in the elevator at AMC. Let's start with cardiovascular. Okay, this is what a normal dog thorax will look like. Okay, you guys might have learned about what the normal structures should be. On a left lateral projection, you might have artery, bronchus, and vein, the vein being the more ventrally located structure. There's a large amount of crossover of the pulmonary blood vessels on the left lateral projection as well. This would be artery and this would be bronchus. The vein is kind of hard to see for this guy, but the veins are ventral. And the veins on the VD view are central. So if this is our trachea and we bifurcate, this is the artery, that's the bronchus, and that's the vein. On this side, the artery would be here, the bronchus is there, and there's a vein somewhere in there that I can't see very well. So yeah, that's the pulmonary blood vessels. I'm going to be talking about them soon, so that's why I want to introduce that to you guys right away. And I could potentially see that on board. So you want to remember veins are ventral and central, okay, and arteries are away from the cardiac silhouette, are more laterally located on the VD projection. Cats are similar, but it's a lot harder to separate arteries and bronchus and veins just because they're smaller. This is the normal thorax of a cat. You might notice that the vertebral bodies are a bit more elongated, they have straighter humerus, and they just look so beautiful. I love cats, and you can really separate a lot of the anatomy. In this guy, there's not a ton of fat in the mediastinum. This is the caudal vena cava, and there's your artery, bronchus, and vein, but it's a little harder to see the vein. Artery is on this side, again, away or out laterally, and those are your pulmonary arteries. It's the cardiac silhouette, liver, stomach, transverse colon here. Okay, yeah, and we use restraining devices to keep them still for a couple of seconds. Onward. What does cardiomegaly look like? What's a big heart look like? I'd say the most common heart enlargement you're going to see is left atrial enlargement in a dog. And this left atrium is right here. You might have learned the caudal waist of the cardiac silhouette in a dog. This is the caudal waist. And this is a large left atrium that is kind of giving us the backpack sign. I think I've heard some students talk about that. This VD view is a little bit oblique, but oblique is okay. You should still be able to see things. And this rounded butt appearance here, that's the left atrium. Remember, the left atrium does not make out the outer margins of the cardiac silhouette. The left atrium is in the cardiac silhouette. Okay, so that is a potential boards question, I would imagine. You've got the border here that's made by the left auricle. So from here to here, it's not left atrium as many people might think. The left atrium is going to be right here. And then when the left auricle is large, it'll bulge out and give us a bump here. But again, it's not the left atrium, it's the left auricle. Okay. What's the clinical relevance of this? Well, as that left heart gets larger, it starts to displace the thoracic trachea dorsally. See how it's kind of going up towards the vertebral column there? And that big left atrium likes to squeeze or attenuate the main stem bronchi, potentially resulting in a cough in our dogs with cardiomegaly. Most common reason for left atrial enlargement in most most dogs, I'd say classically small breed dogs, is going to be mitral valve degeneration. You also see it in cavies. Mitral valve degeneration leading to eccentric hypertrophy of the left side of the cardiac silhouette, and most notably the left atrium in this case. Okay. All right, so this guy has left atrial enlargement, but guess what? His artery, which is right here, and his vein are actually kind of small. Maybe this guy's on Lasix. Maybe he doesn't have congestion yet. It's important to look at the pulmonary blood vessels in cases of cardiomegaly because you want to make sure that there's no evidence of congestive heart failure or early congestion or distension of the pulmonary vein. Okay, this is a case of a lung pattern. We've still got that big left atrium, okay? But what's new is that he's developed a lung pattern in his left caudal lung lobe. Remember before we were just talking about what makes the left side of the cardiac silhouette from 1 to 3 o'clock on the VD view? You see this little bulge that's forming right there? That's a big left auricle occurring concurrently with a large left atrium. So yeah, this guy's heart enlargement is so substantial that his left auricle is large, as well as the left atrium. And he's developed a caudodorsal lung pattern, which is pulmonary edema until proven otherwise. You might notice the pulmonary vein's a little generous right there. It's not huge though. It is slightly larger though than its corresponding vein, than its corresponding artery. So yeah, there's a little bit of congestion there. But this dog is positive for cardiogenic pulmonary edema. We need to treat him and get an echocardiogram. Okay, this is from mitral regurgitation, from mitral valve degeneration. Okay. In general, the edemas are caudally and dorsally distributed on a lateral view in a dog, and the pneumonias are cranial and ventral distributed in a dog. Okay, so lung pattern distribution is really what's most important. Not so much interstitial versus alveolar. That's for another time, another lecture. But if you can just start to think about lung pattern distribution, all these air bronchograms here, this lung pattern is, there's a lung pattern everywhere in this dog with pneumonia, but it's most severe cranially and ventrally. That's why we think he has pneumonia. In this dog, his lung pattern is worse caudally and dorsally. And there's 2 types of edemas that we talk about in dogs. Cardiogenic pulmonary edema, as well as non-cardiogenic pulmonary edema. We'll get to that other stuff later. Sorry. Cats are so tricky. Cats just never play by the rules. This is a cat in congestive heart failure. His cardiac silhouette is mildly enlarged. How do I teach mild enlargement of the cardiac silhouette in a cat? It's really hard. Even if you learned about vertebral heart scores, they can be tricky and unreliable, especially in cats. But this cat is in heart failure, and I feel very confident in heart failure, not only because of the large heart, but also look at these pulmonary blood vessels. I'm not going to separate, artery from vein so much, but look at how they just kind of make this swoosh appearance. They kind of are distended and almost look like cords extending from the hilus on the lateral view. I like to call that the villain's mustache appearance to the cardiac silhouette. This is pulmonary blood vessel out here. Artery or vein, they're all going to be big in some cases of congestive heart failure of cats. There's also this slight retraction that we're seeing to the cardiac, to the pulmonary blood, the visceral pleural margin of the lung. This guy has a little bit of pleural fluid, okay? And they'll teach you in emergency that anytime you have pleural fluid in a cat, you should always consider congestive heart failure. And that rounding right there is another example of pleural fluid. So pleural fluid in a cat, you always have to have as a differential congestive heart failure. It's just a cat thing. Guess what? Not so much in a dog. Pleural fluid in a dog is pretty rare. You don't see it every time. You actually very rarely, if any time, see it with just mitral valve degeneration. You will see it with right-sided enlargement and right-sided congestive heart failure, but the pleural fluid tends to be mild relative to the peritoneal effusion. Okay, so for now, just remember, whenever you've got pleural fluid in a cat, one of your differentials should always be congestive heart failure. It certainly helps in this case since the pulmonary blood vessels are so large and the heart is so large. Okay, how do I teach heart enlargement to beginners? It's hard. It's hard to really measure the shape, but I can promise you that this is a very large heart because it looks like a Valentine, right? On the VD view, you've got this bump here and a bump here, and then it tapers to a more narrow apex. That's the Valentine-shaped heart. It works. It's a sign of cardiomegaly. It tends to be associated with a very large left atrium, and in severe cases, a large right atrium. Notice how I said this is probably the left atrium in a cat. Yeah, because cats are different than dogs. Their left atrium doesn't sit here. It sits somewhere in here. So when their heart gets large, you will see a big bulge, and it will be associated with their atrium. Long story short, look at the VD view and try to get an assessment for the Valentine-shaped heart appearance. On the lateral projection, sometimes you'll see a little dimple right here before the heart starts to round out. And that double-humped caudal border of the heart can be a sign of heart enlargement, though it's a bit subtler, and I can't imagine that would be on the NAVLE. Okay, onward. Let's talk about heartworm disease. Yeah, this is a radiology flashcard for heartworm disease in a dog. You might notice that the lung pattern looks like a bronchointerstitial lung pattern. The airway margins are clearly visible, extending to the lung periphery bilaterally. They're partly mineralized. There's a bit of mineralization to the bronchus right there. And look at this pulmonary artery relative to the vein. Remember, we said artery is going to be here. That's the bronchus, and then the vein is ventral. Look at how the pulmonary artery is this thick and the vein is this thick. Let's go to the caudal lung lobes on the VD view. Look at this honker of a pulmonary artery right here, and then that poor bronchus is even being attenuated relative to the vein, which is right here. Okay, so huge pulmonary artery. Same thing's going on here. It's got a big pulmonary artery. Large pulmonary arteries, you want to worry about pulmonary hypertension. The most common reason for pulmonary hypertension, in dogs throughout the world is going to be heartworm disease. In New York City, we don't see too much heartworm disease. So we'll just see pulmonary hypertension secondary to chronic lower airway disease or primary pulmonary hypertension. But in this case, when those pulmonary blood vessels, those pulmonary arteries specifically are this large, you better have heartworm disease on your differential, okay? So the heartworms, it's kind of a misnomer, right? Heartworms, they don't really live in the heart, they live in the pulmonary arteries. And those pulmonary arteries get big because of intima and tunica thickening, and then you end up seeing it radiographically. The pulmonary hypertension forms simply because of that wall thickening. The pulmonary hypertension also forms because they throw off little clots and they embolize. And so pulmonary thromboembolic disease and lower airway inflammation will contribute to the pulmonary hypertension in these dogs, okay? Oh, cat heartworm disease is so tough. You might notice that the pulmonary blood vessels are large. I always show this one because look at the pulmonary artery. Here's the bronchus right here, and this is the pulmonary artery. Man, you could drive a truck through that pulmonary artery. And for a cat, that's a huge pulmonary artery. This cat does have heartworm disease, but I will say that cats never like to follow the rules. They'll have a big pulmonary artery for the first 6 months and then it'll just look like a bronchointerstitial lung pattern. You won't see the large pulmonary arteries, okay? Same rules to look for, though. I think it's warranted to always have that conversation. And if you've gotten anything from this lecture so far, remember, veins are ventral and central. The arteries are away relative to the bronchus. So on the VD view, the artery is lateral to the bronchus. The vein is central. Harder to do for the laterals on this. We'll have to compare it to other exams, but it's something like artery would be up here and vein would be ventral further down. Okay. All right. Onward. We already showed a case of this. This is mitral valve disease in a dog, the big, large left atrium. I guess that's all I want to say. I've already talked about mitral valve disease in dogs. Okay. Dilated cardiomyopathy can look a lot like mitral valve degeneration. In fact, you know, if it's one of your differentials when you see left atrial enlargement, it still could be DCM. It helps to know what breed you're looking at. So a classic breed for dilated cardiomyopathy, I guess I would think Dobermans. And if I saw a radiograph with a big heart and a Doberman, I guess it would be dilated cardiomyopathy until proven otherwise. Boxers would be another example. This is not either one of those, but his heart is tremendous. And that heart just looks so, it almost looks globoid, has rounded margins. And it's not limited to just the left side. The right side is really bellowing forward. This is a case of DCM. And yes, the dog also has cardiogenic pulmonary edema. So he's got edema forming in his columns. Okay. Yeah, so it can be hard to differentiate DCM in dogs from mitral valve degeneration. You really need breed to help you differentiate the two. All right, let's go to primary respiratory rather than cardiovascular, okay? Oh, we got to talk about feline chronic lower airway inflammation. It can be either, you know, I was taught when I was a kid, when I was in vet school, it was all asthma. But it's not all asthma. I think the preferred term these days is feline lower airway disease, and there's two types. There's the eosinophilic form, which is an asthma, and then there's the neutrophilic form, which is a bronchitis. And there's radiographically no way to tell between those two. What you're just looking for is just heavy linear marks throughout the lungs, linear marks that aren't just blood vessels. It starts to kind of look like the nooks and crannies of an English muffin, okay, to give you that bronchial pattern, okay? And some lungs hyperinflate and some lungs collapse. And I will say the right middle lung lobe, which is right here in this guy, is totally collapsed. It's just a triangular bit of nothing. And collapse of the right middle lung lobe is very common in cases of feline asthma or bronchitis. So keep that in mind. I could see that potentially being a board exam question because it's so common for the right middle lung lobe to collapse in cases of feline asthma. The thinking is they produce a lot of mucus and it tends to cause a plugging to the bronchi as a result, and then cause collapse. Okay, so yeah, we see a lot of that. Dogs, we see a lot of this small breed dog with a trachea that just looks so homogeneously soft tissue opaque. This is a small breed dog with a honking characteristic to his cough. This dog has chondromalacia causing tracheal collapse. Super, super common in our small breed dogs in New York City. It's not uncommon to see a concurrent bronchointerstitial lung pattern in these guys because chronic hectic bronchitis is very common, occurring concurrently with chondromalacia causing airway collapse. It's also pretty common to see a large liver. This is the liver silhouette. See that rounded margin and how it extends way beyond the costal arch and causes caudal displacement of the gastric axis? That's liver. Yeah, there's different speculation as to why livers become large in animals with tracheal collapse. Some people think that it causes a bit of a Pickwickian appearance and causes congestion from increase in pressure in the thorax. Other people just say that it's probably because these dogs also have vascular hepatopathies, including Cushing's disease. So yeah, we will see a large liver occurring with tracheal collapse. For boards, for the NAVLE, I guess, just recognizing that, yeah, this trachea is very small. And it, you know, you might have learned in vet school that there's a dorsal tracheal membrane. And yes, this is the dorsal tracheal membrane, but that dorsal tracheal membrane is coming all the way down to the bottom of the trachea. And there's no gas left in this part of that trachea. That's because the trachea is no longer a rigid cartilaginous structure. It's totally flopped like a sock. So that dorsal tracheal membrane is even more prominent and it's attenuating. It's really hard to see on the VD view. I don't think I'd ever be able to call it on the VD. Okay. Onward. Oh, love this case. Um, this is a dog that is chronically regurgitating. And you might appreciate that he's chronically regurgitating because his esophagus, which the dorsal margin is up here, the ventral margin, it's doing something like this. All right, same thing up here. Here's your dorsal margin. We sometimes talk about the dorsal tracheal membrane. That's just because there's gas in the esophagus. On the VD view, a gas-filled esophagus tends to look like a V. So the two lateral walls of the esophagus tend to converge towards the hiatus and give us a V. Okay, I'll remove those lines so that you can go back and look. This guy has moderate generalized esophageal distension because of megaesophagus. Okay, and dogs with megaesophagus love to aspirate. And there is a lung pattern sitting right over the cardiac silhouette, right here. That's pneumonia, aspiration pneumonia. Sometimes in larger breed dogs, you don't see the pneumonia over on the VD view, lateral to the cardiac silhouette, because they're deep chested. You really got to rely on looking over the cardiac silhouette for their bronchograms to call it. Okay. So yeah, that's right middle lung lobe pneumonia. The right middle lung lobe is the most common lung lobe for pneumonia in the dog, aspiration pneumonia, followed by the right cranial lung lobe. Okay. I think that could be board fodder for sure. Remember, we talked about the right middle lung lobe in cats, and in those guys that have asthma, that lung lobe collapses rather than stays the same in size. Okay. So, and collapse of the right middle lung lobe is rare in dogs. Okay. All right, cool. Yeah, mega esophagus in this dog with secondary aspiration pneumonia. Oh man, I hope you guys are all looking at this from home and can figure out that this isn't normal. This is a diaphragmatic hernia. You can't really see the cardiac silhouette. What are fecal balls doing in the chest? This is the colon being displaced cranially. These are gas-filled loops of small intestine, combination of fat and soft tissue, likely representing, any old abdominal organ and some abdominal or mediastinal fat. So this guy has a diaphragmatic hernia. It's so extensive, it's really hard to figure out what caused it. I would guess that it's probably from trauma that he has this hernia. Cool. Pneumothorax along the lines of trauma. Sometimes dogs and cats get hit by a car. And you will look for pulmonary blood vessels that just don't make it out to the lung periphery and then become really, really black. That's gas in the pleural space. On the lateral projections, what you look for is a dorsal lifting of the cardiac silhouette. It looks lifted, but it's because the collapsed lung from the pneumothorax makes the heart kind of fall away from the sternum. So this gas between the heart and the sternum is the pneumothorax. And I would say, if you're going to take a board exam, you really need the lateral view for the pneumothorax to appreciate it. I don't know if the NAVLE is going to have that kind of detail where you'll be able to say the pulmonary blood vessels are making it out to the periphery or not. Just remember, a dorsally displaced cardiac silhouette should be thinking, oh man, does this guy have a pneumothorax? Okay. This guy was hit by a car and he had bilateral pneumothorax, more notable on the left. And yeah, he recovered. He recovered fine. I know this dog well. We got to talk about NAG lesions, right? Big old soft tissue things. Look at how perfectly round this thing is. Okay, we call these NAG lesions, neoplasia, abscess, or granuloma. Basically, well-margined, discretely, often round masses in the lungs. Okay, so it can be associated with neoplasia, abscess, or granuloma. And in this case, it's a primary lung tumor of the right caudal lung. Okay. You can also consider pulmonary metastatic disease. I'll lean more towards that if I see more than one, and if they're slightly smaller than that. You can't rule out granuloma depending on where you live. Fungal granulomas can look exactly like this. So these are your NAG lesions. This, in New York City, because it's a bunch of nags. It's a bunch of discretely margined and fairly small nodules. In New York, it's neoplasia, but specifically it's metastasis from some cancer somewhere else. But remember, you know, abscesses can look like this and granules can look like this. Oh man, I can give you a history for this radiology flashcard. I know he's young because he doesn't have mineralization of his cartilaginous part of the ribs. I know he's young because he does have physes here. This guy's just like 7 or 8 months old, okay? And he's got this fulminant caudal dorsal lung pattern. See how white the lung pattern is out at the periphery? Remember what we said before? What is the differential? What are the differentials for caudodorsal lung patterns? Those are the edemas, right? If the lung pattern was worse down here, we would be thinking pneumonia. This is a young dog with a fulminant caudodorsal lung pattern. So I have to worry about 2 types of edema, cardiogenic and non-cardiogenic. The heart's pretty normal in this guy. I actually think, if anything, his heart looks small on the VD view. Let's talk about it. Caudodorsal, think edema. Ask yourself, is the cardiac silhouette large, like the case in the bottom here, where we've seen multiple cases of, right? Mitral insufficiency, DCM, HCM. That would be cardiogenic pulmonary edema causing this increase in opacity. But in our dog here, he's a puppy. It's got a normal heart. And boy, oh boy, puppies, especially around Christmas time, they love to hang out behind the Christmas tree and get electrocuted. So this is a non-cardiogenic pulmonary edema associated with electrocution. So you have to worry about electrocution in small dogs, in young dogs that like to chew things that they shouldn't. Seizuring dogs can also give this lung pattern. Upper airway obstruction, so like our French bulldogs that come in on a hot summer's day, they will have a choking event, near drowning event, and that can cause this lung pattern as well. Other things like vasculitis and acute lung injury, acute respiratory distress syndrome, those are all things to think about when you get these fulminant lung patterns caudally and dorsally, but the heart is normal in size. So non-cardiogenic pulmonary edema. There's often a history that helps support it. Something like, oh yeah, he was playing with the wire, you know, or he was choked, or he fell into the pool, and then we saved him. So these are the type of lung patterns that you'll see with non-cardiogenic pulmonary edema differentials. Okay. All right. So you can rely on the left atrium in dogs. We said that. Can't really rely on it in cats. And here's our left atrium again. I know I'm beating a dead horse on this one, but the other time to think about soft tissue in this area is for another disease, okay? This increase in opacity that we're seeing on this dog is not because of a large left atrium. When you have a large left atrium, you also bring up the trachea and the main stem bronchi. You see how the trachea here is parallel or coming up close to the vertebral column? In this case, the trachea is diverging from the vertebral column. In fact, the main stem bronchi and carina are being diverted downward, okay? Times when you see this degree of downward displacement of the carina and main stem bronchi and no dorsal displacement of the thoracic trachea, it's because of tracheobronchial lymphadenopathy. There are tracheobronchial lymph nodes here that are increasing the opacity to the perihilar region, not a large left atrium, okay? So keep that in mind as another differential for increased soft tissue opacity in this region, big lymph nodes. Depending on where you live, this can be associated with fungal infections, okay? This dog had really bad lymphoma. So that's it for this portion of VetCanly's NAVLE prep on radiology, where we covered the cardiovascular and respiratory systems. Next time, we will cover the abdominal and musculoskeletal systems. If you have any additional questions, please be sure to drop them in the chat. Thanks for joining us today, and good luck on your exam.